You've followed everything that every provider has said to do. You've kept your appointments, you've done your homework, and you're frustrated. You're still having pain. You probably have an attorney representing you, and maybe the attorney is wondering if you're exaggerating. The technical word would be like malingering, right? And maybe you're starting to wonder, am I crazy? Am I really having pain? Well, stop right there. You're not crazy. This is like really common. About 47% of people involved in a car accident are going to have continued significant problems for the rest of their life. Those people that are having continued significant aches and pains, most of the time it's because they have ligament laxity and it hasn't been properly diagnosed. Hi, I'm Dr. Michael Pasternak, a chiropractor in Winchester, Virginia. I'm with Winchester Spine and Injury, and I specialize in whiplash, chronic neck and back pain after some type of car accident or an automobile injury. So maybe you're having chronic neck, back, or maybe even headaches after a car accident. And you've gone to your family doctor, you've probably seen the physical therapist, possibly you've been to a chiropractor, maybe pain management, maybe even like an orthopedic surgeon or a neurosurgeon. But the thing is, you're still having this chronic neck or back pain, and it's puzzling because you've followed everything that every provider has said to do. You've kept your appointments, you've done your homework, and you're frustrated. You're still having pain. In fact, let me show you what some of the studies have to say. So here's like a list of 9 different studies. I'm just going to read one of them just as an example. If I look at this one from the Journal of Neuroorthopedics, it says the authors reported that 62%, did you hear that? 62% continue to suffer from significant pain symptoms attributed to the motor vehicle collision 12 and a half years earlier. But the point is, the conglomeration or the consensus of all of these studies, if I average it out, 47% of the people involved in a car accident are going to continue to have chronic, significant pains for the rest of their life. So I've been in practice 31 years. I've had probably about 10,000 new patients, and I'll tell you, those numbers are real. They're real every place in the world. Half of the people, the new patients that I see, they do relate it back to a car accident, often 10, 20, 30 years earlier. So it's very common. I can tell you that there is a diagnosis that's usually missed that's a very likely culprit, that if you're having continued chronic neck and back pain after a car accident, that it's the cause of it. It's called ligament laxity. Now I'm going to talk about that in just a minute, and I'm going to keep it simple, but I have a story I'm going to tell you, and once I get through telling you what ligament laxity is, about a patient and how having the right diagnosis completely changed the quality of her life. You've got to hear this story, so I'll come back to that in just a moment. Here's the thing. It's interesting because about half of the patients that I see in my office that have been in a car accident and I test them for ligament laxity, about 50%, half of them have ligament laxity. And keep in mind from what I just said with those other studies that about 47% of people involved in a car accident are going to have continued significant problems for the rest of their life. Do you see that correlation there? What I'm telling you is those people that are having continued significant aches and pains, most of the time it's because they have ligament laxity and it hasn't been properly diagnosed. So let's talk about what a ligament is for just a second. I want to keep it simple. So a ligament attaches a bone to a bone. So like if we're looking at the plastic model of the spine, you can see all of these different bones. And so like you'll have a ligament that attaches from here to here, and from here to here, and from here to here. You'll have another ligament that attaches from here to here, from here to here, and etc. You have all these other ligaments like this part of the bone here to here, that's where this ligament is attaching from here to here, which is what I was just showing you. You can see here's a bone, and there's the disc. Here's a bone, here's the disc, and here's a bone. And so they're showing this ligament attaches from this bone to this bone, from here to here. Think of like if you had a high-rise building, the ligament gives it strength. That building gets its strength from like the metal girders. That would be like the ligaments. It gives strength. Unfortunately, in a car accident, because of the speed at which a car is either at a standstill and then it gets rear-ended and hit, the head gets whipped back and forwards. It's the speed at which it gets whipped back and forwards that it can tear the ligaments. Most of the time it's not a complete tear, but it's a partial tearing, and that leads to ligament laxity. When you're going to try and diagnose ligament laxity, you can't eyeball it. You can't take an x-ray and just look at it. And you can't diagnose ligament laxity by listening to a patient or doing just an exam with the patient. It's similar to like if someone has a herniated disc. You can't tell that they have a herniated disc by listening to them, right? You can't tell by just your physical exam. You may have an idea that that's what's going on, but the way you actually confirm it with objective, demonstrable evidence is you get an MRI, because that's what's going to show it, right? And so thankfully the AMA guides to permanent impairment, the 4th, 5th, and 6th edition, spells out the exact protocols of how you would actually measure for ligament laxity. And so I said I was going to tell you about an interesting case. So let me do that, because it's not just like theoretical stuff we're talking about here, right? Ligament laxity is probably affecting about half of the people that's been involved in a car accident. And you know, if you're watching this video, you probably have ligament laxity. At least there's a decent chance of that. So I mean, this is real stuff, and it pertains to you probably. So this example, the patient, she gets in a car accident, and you know, she goes to see her family doctor. She sees 2 different physical therapists. She goes to pain management numerous times. She goes to a neurosurgeon numerous times. It's 4 years later, and she's still having chronic significant pain. She's wondering herself if maybe she's imagining it, right? You know, because nobody seems to be able to find what the problem is, yet she's still in pain. Maybe her attorney is starting to wonder if she's faking it. The insurance company, they don't want to like pay her anything. They're offering her next to nothing because they think she's imagining it. No one can find the problem. So anyway, I do an independent medical exam on the patient, including reviewing all the records and the x-rays that they've already taken. So I didn't take any new x-rays. I just used the x-rays they took. But see, when the neurosurgeon looked at those x-rays, he eyeballed it and said everything was okay. I went and I took those x-rays and I followed the exact protocols in the AMA Guides of Permanent Impairment, the 4th, 5th, and 6th edition, which says that you can't eyeball it, you actually have to digitize it, which means you need specialized computer software to actually measure. Here's somebody's spine, and we're looking at it from the side. And what you have to do is you have to put a dot in the corner of the 4 corners. So at the top, another one over there, you put a dot there. So you do that on all of the vertebrae, the bones. And then you have a patient bend as far as they can, and you take the x-ray, and bend backwards as far as they can, take the x-ray. And you use the computer to actually measure those dots and measure the specific movement between each vertebra to see if there's ligament laxity, and that's why you can't eyeball it. So I took their x-rays and I digitized it, right, according to those protocols of the AMA Guides for Permanent Impairment, the 4th, 5th, and 6th edition. It turns out the patient does have ligament laxity. In fact, she has enough ligament laxity that it met the threshold in the AMA Guides that I could award her a 28% impairment in her cervical spine. Once I was able to find out what the problem was, the really amazing thing is I was able to get the most accurate diagnosis, and I talked about this in a prior video, that getting the most accurate diagnosis drives the most appropriate treatment, which then gets the best clinical outcomes, right? And so once I knew what the most accurate and specific diagnosis was, I was able to make some recommendations to the patient of what things she could do to help minimize her chronic pain. So to follow up, the patient did follow my recommendations, and she was able to decrease her pain by probably 60%. So 100%? No, because she still had ligament laxity, but we were able to significantly improve the quality of her life. And that's really the most important thing of why I'm even doing this video, because if you have chronic neck pain or back pain, just imagine if we get the most accurate and specific diagnosis, you probably have ligament laxity, we can probably improve the quality of your life. And that's what's so important to me. The patient's attorney in this example, now that he had objective, demonstrable evidence that showed that, hey, this person really was injured, they're not making it up, and here's the problem, he was able to explain that to the insurance company, and instead of them offering basically nothing because they thought the patient was crazy, now they gave her full policy limits because she'd been suffering for 4 years already, and they knew that she was going to have problems for probably the rest of her life. So this is important. So if you're having chronic neck or back pain, go ahead and call us. Let's see if you have ligament laxity. If you know someone that's having chronic pain after a car accident, a whiplash type injury, well, forward this video to them. Let's see, the bottom line, let's just see if we can get the most accurate diagnosis so that we can help improve the quality of their life. Because that's why I love being a chiropractor here in Winchester, Virginia, is to help people, especially when they're involved in a car accident, because that's what I specialize in. Dr. Michael Pasternak, a chiropractor here in Winchester, Virginia. Follow us on social media and pass this video along to someone you know with chronic pain.